all for attending this press conference. We are living in unprecedented times that few, if any of us, could have foreseen. It's one of government's responsibilities to prepare for situations that endanger citizens. Fortunately, we in Yates County have well-trained and capable people who take that responsibility very seriously. Our plan this morning is to describe for you the status of COVID-19 testing conducted on Yates County residents, actions taken in response to the situation, and executive orders from our governor, and actions that may be forthcoming. We will then open the floor for questions. Last Friday morning, I asked our county administrator to convene a task force with its mission to assess and prepare for situations that may need to be addressed by Yates County during the ongoing COVID-19 pandemic. The task force has met weekday mornings since then to continue to monitor the situation. The members of the task force are the people assembled around this ring. Noni Flynn, our county administrator to our right, Ron Spike, our county sheriff, Deb Miner, our director of public health, Sarah Christensen, our deputy director of public health, Brian Winslow, our director of the Office of Emergency Management, Tim Grove, our information technology director, Carrie Brennan, our personnel director, Craig Pryor, our deputy highway superintendent, Joe Reed, our supervisor of buildings and grounds, and we also have, while she's not part of the task force, we have, for questions relative to the hospital, Laura Turbide, the Vice President of Community Services from Finger Lakes Health. This time I'll turn the floor over to Noni Flynn, our county administrator.
Thank you, Doug. Yesterday, Governor Cuomo issued an executive order restricting local governments to operate with a 50% workforce reduction through April 15th. Immediately, I worked with others in county leadership to develop a plan to practice social distancing, as advised, while still operating county services that our residents rely on as best as we are able. Because we will be operating with a reduced workforce, we ask that you be patient. Entry into our county office building will be for official business only today and by appointment only beginning tomorrow. Our task force is working daily to ensure our community is prepared for this global pandemic. We have been engaged in aggressive efforts to mitigate the impact of COVID-19 and keep our employees and the public safe and healthy. At this time, there are no confirmed cases in Yates County. We are in this together, and the only way we will slow the spread of this virus is by acting together. Most of us will be fine, even if we do get sick, but all of us have a responsibility to protect the most vulnerable of us. If you are sick, stay home and call your doctor. If you are healthy, you have a responsibility to stay home if you can. Each of us has control over where we go, how we social distance, how we wash hands and clean surfaces. Each of us has a civic duty to ourselves and to our fellow citizens to do our part to keep one another safe. Next, I'll introduce Deb Miner, our Director of Public Health, who has been working with me on the task force to provide expert guidance on appropriate measures to deal with this crisis.
Thank you, Ms. Flynn. Again, my name is Deb Miner. I'm the director here for Yates County Public Health. And as Ms. Flynn stated, we do not have any confirmed cases in Yates County at this time. We currently have 11 individuals who we have submitted testing on. 5 of those have returned negative and 6 are still pending. We are in daily contact with our neighboring counties to stay informed of their status as well. We are working with the residents here in Yates County who may have been exposed to COVID-19 to ensure their safety and the safety of the overall community. We are working closely with our hospital and providers to facilitate any confirmatory testing that is deemed appropriate and ordered by the physician, as well as ensuring the isolation, monitoring, and quarantines as appropriate for those in Yates County. At this time, we need everyone's help to flatten the curve through social distancing. Social distancing means avoiding close contact with other people. and we need the community's help to adhere to this. Please stay home as much as possible. If you're going out, try to keep at least 6 feet between you and others. Avoid crowded places, avoid discretionary travel, shopping trips, and social visits. Postpone appointments or see if you can get to do them online or by phone. If you are able, sign up to get your prescriptions shipped to your home. These actions will help to slow down how quickly the virus can spread in our community. This is what people mean when they say flatten the curve. Remember that older people and those with serious underlying health conditions are at particular risk from the coronavirus. It is very important that we slow down the spread of the virus to make sure that our hospitals, our providers, and those of us here helping to address the issue have the time and the resources needed to treat the patients who get seriously sick. And thank you. I will now ask if my deputy has any additional comments to make.
Thank you. I think I'm just going to go more from the community standpoint and just stress how awesome it has been seen in the last few days of how we are all coming together, like Noni and Deb said, and the importance of that. I've seen a lot of social media posts as well as just through conversations with other community members that people are just willing to help. And I think we know that that's true living in a small town America, in my own words, and we saw that back in our flood response. And I think this is just a different helping mechanism compared to what we all did in response to the flood. And I think that, you know, our community partners and our community members are stepping up, like the Living Well, and making sure that our community members have access to food for meals by delivering items and calling our senior citizens to check in on them, because it's just so important, because I think we all have to remember that mental health is just as important as physical health in the coming weeks for all of us. Our school districts have been tremendously helpful, and their faculty and staff have done an amazing job in making sure the needs of our children are being met during school closure periods. They're setting up drive-thrus for food pickup. They're hand-delivering educational materials to families. Teachers are doing YouTube videos or virtual instruction so our children can see them and be reassured by someone that they love and trust that they will all get through this together. I've been seeing parents helping each other with daycare needs or in-home daycare, providers offering to watch others' children because individuals still have to work. I've seen landlords who are willing to postpone rent payment for individuals who've been laid off temporarily due to business closures. I've seen local restaurants offer free lunches to school-aged children. I'm seeing neighbors helping neighbors, especially, again, checking in on our seniors to make sure that they have groceries, they have their medications, they have their toilet paper, which I know is a huge craze at this point. And I think, you know, we want to stress that we want to support our local businesses in any capacity that we can. And I think we're just at the point where we have to think outside the box. Many of our restaurants have gone to, you know, call in your orders and come in and do takeout or curbside delivery. So I think we all have the duty in supporting them to the best of the ability we can. I loved seeing WFLR putting a post on yesterday asking people to take the picture of like their most expired product in their house. Because I think humor also gets us through tough times. And that's what I'm trying to do through my very long days here. As well as our nighttime work, because you know we don't stop here at 4 o'clock when we're in a pandemic response. So I just want to thank our community for coming together and the work that we're going to do in the coming weeks as well. So we can, we will get past this. It's going to take time, but just if we all just try to be there and support each other, it's going to make that a little bit easier.
Thank you. And now I'll turn it over to Sheriff Ronald Spike.
Thank you. Good morning, everyone. It's good to be a part of this task force, and we certainly appreciate the chairman and the administrator putting this together on a regular basis to discuss ongoing things. They're very fluid and changes from day to day. These are certainly unusual times in our lifetime, for sure. And as far as the sheriff's office goes, public safety is our mission, and we not only public safety is paramount, but the safety of our officers is also paramount to me. If we don't keep our first responders healthy, there won't be anybody to respond. So that's really important that we do that. And even though these are challenging times, and sometimes it's impossible in a lot of cases for a first responder, a law enforcement officer, or an EMS provider especially, not to have closer contact with an individual. One of the things that we're doing, that we have in place at the public safety building, is the fact that we have glass barriers between anyone who would be a receptionist, either coming to the jail or coming in to make a complaint. And then we also have a telephone there that the individual can actually talk to the dispatcher from that, so there doesn't have to be a one-on-one contact situation by using those barriers. So we've instructed that we'll be doing that. We've had great response from the buildings and grounds from the county to help us with our disinfection. That's one huge area that everyone, whether you're at home or in office or you're here at the county government, our buildings and grounds people have been really great in helping us with disinfecting areas. That good cleaning is so important. We've stressed on our officers that we have to practice social distancing and be aware of this close contact with other people. We just want to reduce this community transmission of this virus. All new admissions to the jail are not only being screened for travel or health questions that public health helped us put together to screen them, but we're also taking the temperature of anybody that's admitted to jail to see if they're fighting a fever. Other procedures are in place, not only at the jail, but at the courthouses, with notices on our entrances. And again, we've got a barrier there at the courthouse where we can interview somebody through a glass barrier. So interacting with the public in this public safety arena in close contact is something we're trying to avoid whenever we can. But you know, this thing can be transmitted by somebody coughing or water droplets coming out of somebody's mouth that would come in contact with us, with a first responder's mouth or eyes or whatever. So we again have advised our people to stay 6 feet away for a long period of time, or 3 to 4 feet on short periods. We've advised when we send a deputy to somebody's residence that the deputy may call them on a phone and ask them to step outside so that we can maintain our distance, that type of thing. We have really preached to our members that good hand hygiene is so important. And they've all been issued various personal protective equipment, gloves, particle receptors, respirators, and that type of thing. The other thing that we've reminded them of is that we must disinfect our patrol cars, disinfect our duty belts, and disinfect other areas, vehicle seats, any places where there's been contact to maintain that. Same holds true if we release something from jail, then we do a whole disinfection of that particular cell just as a good practice. In other words, so if you call our non-emergency number, probably an officer is going to call you back to find out if he's something he can handle over the phone, or if he does have to meet up with you regarding that issue, and then the social distancing will take place. The other thing is that we want to make sure that our staff make sure that everybody understands that please still call 911 if there's an emergency. We're going to send the closest law enforcement officer to you, or whoever the appropriate first responder is as far as EMS, fire, or rescue. Our dispatch has gotten many calls, and many of those things are outside our wheelhouse, but we have no problem with people calling, and we will get you the help that you need. If you need to be referred to public health, we'll make that referral or referral to others. So, we get all kinds of calls. Yesterday I had an individual who called because they were going to have 350 people at a wedding today. And what do we do about that? And I had to tell them that right now, no more than 50 can assemble. And so I said, you're going to have to make some changes there. But as long as he heard it from the sheriff, that was okay. But that's who we wanted to hear it from. So, these are day-to-day challenges that certainly affect our mission. And we ask everybody to have good judgment and common sense going forward to maintain our health. Prevention is really key. Prevention is key for everyone. To pick up on what Sarah said, this is such a great community of resources and volunteers. Neighbors helping neighbors. I'm hearing stories about that all the time. I was at a Lions Club board meeting last night, and they voted to give a considerable amount of money to the Living Well and the Millie's Pantry, and then looking at other things to do to help. So those are all important. Some other specific things that we're trying to do is we're trying to see if through the court system if we have to fingerprint everybody that we arrest right now, or can we give them an invitation to appear later for fingerprinting? That's one way to keep them out of the facility and in contact with others. Or if an arrest requires just an order of protection, can we get the court to come in and issue that while the individual stays in the car? Do they have to actually be arraigned? Type of thing. So we're looking at all these types of issues to try to reduce contact and to keep everyone safe. So I thank you for the opportunity.
Thank you. First of all, just want to reassure everybody that fire and EMS is still operating at normal capacity. We have altered some of our responses in-house to try to limit the contact should we get a call for some of these calls. We have forwarded recommendations to the fire and EMS services in the county, so they're aware of what precautions need to be taken. All requests are being handled by our office from governmental and healthcare facilities for equipment that's needed for their operations. Through that, however, the requests are going in, all have been scheduled or put into the state for delivery. There are no guarantees on delivery time and things like that. So together, we're all working together to make sure that the stuff that we have, we're trying to make it last as long as we can. But again, the biggest thing for our aspect is that fire and EMS service will continue, and we will be there to serve the communities. Thank you.
Thank you, Brian. At this time, we'll entertain any questions that might come forward. John.
To Deb and to Laura Turbide, how many hospital beds are currently available in the county?
I will defer that to Laura. As you can imagine, we have emergency preparedness plans, so there's your typical license numbers of beds, which is a critical access hospital here, so it's over 25. With emergency or surge capacity, we have plans, as you can imagine, to prepare for a surge, and in doing so, some of the decisions we're making are some of what you're hearing from others, things like canceling elective diagnostic testing. People may be getting a phone call from their physician to say, if you're scheduled for an elective test or something that could wait, or even in other surrounding counties where we also serve other counties, including at Geneva General Hospital, we've canceled things like joint replacements that someone might be able to wait, and that allows us to have that bed available. It also allows us, as Mr. Winslow was saying, in terms of conserving personal protective equipment versus using things, for example, for other processes. So 25 licensed New York State beds, and we also have guidance from New York State that, of course, due to the pandemic, we are certainly expecting and being prepared for surge capacity.
And what would that surge capacity rise to, do you imagine?
Certainly is variable, so I wouldn't want to put a number on it at this point based on some of the determinations and strategies we have in place right now.
Are there any ICU units available in Yates County?
We currently do not operate an intensive care unit here at Soldiers and Sailors, but we certainly do have respirator capacity as well as a Medic 55, advanced life support, and other kinds of services for people in respiratory distress.
And the number of emergency department beds available?
can't answer that specifically. Certainly, the emergency department is open, and we would encourage, again, as we encourage to call 911. We could hear questions. We would still, of course, want people, if you have chest pain, if you have an emergency, the emergency department is open here and ready to serve you. We are encouraging people, if they have more mild symptoms, to call their primary care physician. And again, perhaps call your physician if it's mild symptoms. If it is an emergency situation, whether you fear you have a bowel obstruction, whether you have chest pain, anything, we have emergency department is open, ready, and also has the ability to have surge capacity. And obviously our EMS and emergency personnel have been great partners with that as well. So we certainly don't want people to think the emergency department is not open for regular emergencies.
That's not the question. How many would you be able to handle at this moment?
At this moment, I think we certainly would work to handle as many as arrive, and we have mutual aid with other hospitals as well.
I understand. How many beds, I'm asking, are currently in the emergency department? Where if people are coming in, how many units are there where a person is in a bed being seen?
There are certainly, in terms of beds, there are beds and there are also staff beds. So in terms of the glass doored areas, we may have the ability to manage perhaps 10 patients at a time. Then we certainly have, as you can imagine, in situations like this, we have a first acute medical floor that we would also call into capacity. We would use emergency staff, but in other physical bed locations. And so in terms of surge capacity, as you can imagine, we bring different resources to bear.
With the governor's order asking for colleges and universities to be used, is there any plan to utilize Cuca College as a quarantine facility?
Not at this time that we're actively pursuing. That is something that we may need to look at, but right now, anyone that needs to be quarantined or isolated, ideally it occurs in their home.
Deb, will there be any testing locations set up within the county?
Are you referring to within the county proper that?
Right.
So at this point, we are not setting up a testing location in the county because it is being handled through the provider practices and the hospital system. At this point, that is the best option for us. Again, we need to make sure that we're not stretching our resources by having multiple different locations. So it is preferable at this point to continue the way we are. As the situation unfolds, we may need to change that approach.
Are there priorities in place for who is tested, just based on symptoms or exposure?
Yes, it is. So we have been providing guidance from the state health department that helps to determine who is appropriate for testing. And we work with the physicians and the hospital system to assure that that guidance is being followed. So it is by physician order at this time.
Based upon exposure risk, the question is about testing potential inmates coming into the jail because of the close proximity in which inmates are held, that perhaps testing them, placing them on a testing schedule as well.
At this time, they are screened. So they are screened for symptoms, temperature, respiratory symptoms, cough. They also are screened for any known or potential contact, and they are screened for any travel history. At this time, they are not swabbed and submitted for a laboratory test. Again, we have to preserve our supplies at this point for those individuals that we know have had contact or are exhibiting symptoms and there's no other diagnosis for them.
Were the high school students who were recently in Italy screened in a similar manner?
Screened for symptoms and travel history?
Yes, they were in Italy in February.
We were following the state guidance at that time, and at that time there was not a recommendation for us to meet with them individually, but they were screened through the health services at the schools. So the schools were aware of who traveled, where they traveled to, and they were screened for any symptoms.
Since young people have been shown to be often asymptomatic in this, is there any plan to have them tested?
They are well past the 14-day incubation period at this point.
Mr. Cutler?
Just one question for clarification. The tests that have been done, you said on 11 of our citizens, right? Are they being done in Rochester?
There's a variety, Sarah could speak better to that, but we have both state labs and commercial labs doing testing at this point.
Initially, the majority of our specimens have been sent to the Erie County Public Health Department lab in the Buffalo region, but more commercial labs are coming on board with the ability to test. So non-priority specimens will now pretty much be sent to commercial labs for testing instead of utilizing the Erie County Public Health Department lab.
Any other questions? For legislators that are present, thank you for coming. We have not determined how we will handle committee and legislative meetings yet, but I'll certainly confer with folks and we'll figure out a way to do it. It will most likely will be at least partially via teleconference or some video link. Eric.
Chairman Page, I want to, Sarah, thank you for your comments on the mental health state and our emotional health that we can give our citizens. I appreciate that.
If I could share related to that, the John B. Kelly Behavioral Health Services is still open and is obviously following some social distancing practices and things such as having the ability to make sure that they're doing hand sanitizing things, but certainly want to make sure people realize that we do recognize that there is a need for ongoing support and in terms of behavioral health services for individual clients.
Anyone else? All right, thank you all very much.